Well, one is found in women, usually typically females, and one is usually typically presenting in children. Which one presents in children? Which one presents in females? You have two to choose from, TTP, HUS. Which one presents with triad symptoms? Both do, right? Which one presents with fever and neurological symptoms? TTP. Which one presents with bloody diarrhea? HUS. So make your life easy. Accept the fact that this exam, too much information, pinpoint where you can get points. Excuse me. Thank you. Pinpoint where you can get points on every organ system. Because if you're here trying to struggle, meaning studying every day, anatomy, histology, the spinal thalamic tract, the different tracts in the neuroanatomy, my friend, you're going to waste your time. It took me a semester. It took us usually a semester to learn a lot of neurology. So you're trying to cram it in a couple of questions? I mean, you could try to. But when I ask you a question like anti-epileptics, you don't know, meaning the student. When I ask questions about diabetes, I'm like, do you know between type 1, type 2? Yeah, I do. But why are you getting the questions wrong? Well, I messed up the details. Okay. Do you know the anti-diabetic drugs? You should. I have it in my QBank as well. A lot of stuff that I do here, it's more of talking as a webinar. What I'm working on in my QBank video library is literally get to 3,000 questions. So then basically all you got to do is buy a QBank, Amboss, you all don't care. And then you get my QBank videos and you learn all the different tips, strategies that I'm showing you, that I'm talking about. I do a lot every day to work on step 2, step 3, residency and beyond. I try to maximize my time for you all and help you utilize first aid too, right? So in the QBank, I also have sections with first aid, sections with pharmacology, because I want you guys to do well. So today we have 2 sets that I have for you, GI and pharmacology, specifically behavioral science. I want to show you a few ways that I hacked the system, because like I showed you on Tuesday, if you're sitting here looking at how to differentiate PT, PTT, bleeding time, it can be literally, overwhelming, right? And that's why if you can't attend the sessions, I get it. Different time zones, like Lynn is traveling around the world that time. So this is recorded for you all and archived on the online community, right? So if you want to get the links that I provide, they're there for Amboss. If you want to get the link to the recording, it's there as well. I'm always here. All right. So open up your first aid. Today is the end of the month. Exciting, because next week it starts the next month. It never ends in the USMLE world. So I will say that I enjoy this exam a lot. I do this purposely to help you guys do well. I don't want you to suffer. I don't want you to torture yourselves, right? It's challenging. The test is challenging. Of course it is. May I ask you guys all a question? Yes, Dr. Stavros. Do you guys remember the P450 inducers and inhibitors? Now, I know some of you are like, oh, what do you mean? I kind of know them. I don't know them. The P450 inducers and inhibitors. You should know them all inside out. I can be like my other colleagues and say, memorize. I don't want you to memorize. There's no reason to memorize. Memorize what you can't understand and memorize what you can't connect and hook. Fair? That's fair. So this is my thought process. If I can understand something, awesome. I understand it. I don't have to memorize it.